Hello, everybody. My name is Raquel. I'm going to be going over the newborn baby exam today. So, coming in as a nurse practitioner for this mother and her new baby, dad might be in the room as well. I just kind of want to get a feel for the mother and how she's doing in this new chapter of her life, how she's interacting with the baby and adjusting to motherhood. Same with the husband as well. Um, it's very overwhelming. So try to answer any questions that they have specifically, kind of guide her through and prepare her for how the visit is going to entail, briefing, asking her a lot of questions about her birth story, and then how she's doing postpartum, how the baby's doing. And then I will go into my head to toe assessment. So, first questions are I'm going to ask her about her gestational age that she was at delivery, which she's 38 weeks. This is her first baby. It's her first pregnancy as well. So, she is a G1P1. I'm going to be asking her about any exposure that she had to maybe any toxic teratogens that could have affected the baby, such as whether that be chemicals, food, environmental toxins, viruses, anything like that. I'm going to ask her to see if she was consistent with her prenatal care, what that entailed, any medications. Was she taking a prenatal vitamin? Was she compliant with all of her routine ultrasounds, lab work, OBGYN visits throughout her pregnancy? Asking her about any torch infections that she might have been exposed to. I'm going to ask her about her blood type, which she says she is a type A. Any risk factors for infection, any illnesses that she came down with during pregnancy that could affect the baby, or any medications that she was taking that could affect the baby. Asking her about when her water broke, was the amniotic fluid cloudy? Was there blood in it? Asking if she had any meconium, if the baby had any meconium post-delivery that could have complicated things for baby. Asking her about any hypertension, gestational diabetes, any abnormal weight gain that she might have had in her pregnancy. This mom had a vaginal delivery. She stayed in the hospital for 2 days. She denies having any complications, any excessive bleeding. When baby came out, he was healthy, not needing any supplemental oxygen. She does not know his APGAR score, but he was breathing, didn't need any NICU level of care, or like I said, supplemental oxygen. Baby did not have any issues with breastfeeding. In the hospital, they did meet with a lactation consultant and everything seemed to flow smoothly. Her labor was about 16 hours. She denies any malpositioning of baby. He was not breached or anything like that. Since she's been home, she says that she's developed quite a routine with her and her partner. She is breastfeeding, but she's also pumping as well, so the partner can have a part in feeding baby. She is feeding him every 2 to 3 hours pretty consistently. Baby seems to be having no issues with breastfeeding, taking a proper amount of food with each feeding, and doesn't seem to be losing any weight. But at the same time, this is the newborn visit, so the baby will be weighed at this visit. She says that the past 2 days, the baby has been having about 2 to 3 bowel movements a day, and they are yellow, pasty stools, sometimes have seeds in them, and she's having about 4 to 5 wet diapers, which to me does sound normal. In regards to the baby's activity, the baby does sleep a lot throughout the day, but also is interactive and opening his eyes, looking around the room, responding a little bit to visual and auditory stimuli. The baby is consolable with breastfeeding or a little pacifier. the mom does not notice any type of respiratory distress while the baby is breastfeeding or while the baby is crying. There's no discoloration in the baby. And at this immunization or at this visit, since it's a newborn visit, the baby is getting the hepatitis vaccine, the hepatitis B vaccine, and it'll be their first vaccination. Just prepping this mom too for future vaccinations. At 2 months, the baby is going to be needing the second dose of hepatitis B. They're also going to be needing the rotavirus vaccine, the first dose, the DTaP vaccination, the Hib vaccination, PCV13 vaccination, as well as the IPV vaccination. In regards to just anticipatory guidance for this family, we just want to make sure that their home life is safe for the baby, and they're coping with the parent, with their new role as parents, making sure that they're not bringing any toxic chemicals into their home, nobody's smoking in the home, fumes that can be toxic to the baby. They have a good support system involved, whether that be grandparents, parents, friends, other children, if they were to have other children. Their relationship between mom and dad is good and healthy. There's no abuse. We want to make sure that they are able to afford this. And so we do offer services such as WIC or SNAP for people who are food insecure. And just kind of getting to know their plan if mom is going to be going back to work eventually after her baby bonding and everything is complete. Is dad going to be going back to work? All of that. Moving into the head to toe. So this is our newborn baby. His name is Baby J. Baby J was born at 7 pounds, 1 ounce. He was 20 inches long, which is very healthy. His head circumference. So when I measure his head circumference, I'm going to go from, I'll take his little hat off. I'm going to go around his brow line to the widest point of his occiput and around. And that's going to be 35 centimeters for this baby, which is a normal head circumference right above his ears. Baby's weight was 7 pounds, 1 ounce. Vital signs, lengthwise, he is 20 inches long, and I'm going to be measuring that by laying baby on the table, and I'm going to mark the top of his head and then also the very tip of his heel. And that's going to be how I'm going to measure this baby. Vital signs wise, heart rate is 135 beats a minute. His blood pressure is 60/40. Temperature is axillary, it's 98.6. He's breathing 35 breaths a minute, and his SpO2 is 99%. General appearance, looking at this baby, I want to make sure that this baby has good tone. He is not excessively stiff nor excessively floppy. A way that I can see that is by holding baby up like this. And if they start to slump over and not be able to, have any tone in their body, that's an abnormality, versus also kind of laying in a plank like this. If baby were to do that, that would be a sign of an abnormality as well. We expect baby to kind of be tickling their legs around and kind of moving sporadically, not being too still or too overactive. We can have baby be consoled by just putting a little finger in their mouth like this, and this is instigating their sucking reflex. And they should be calmed by that. We want to look at baby's face and make sure that it is symmetrical. There's no excessive wrinkles. There's no lacerations on their head. Their eyes are set at a normal set. They're not too far apart nor too close together. We also want to look at the ear placement and make sure that the ear placement is kind of the top of the ear, the helix is in line with the corner of their eye. if they are low set, that could be indicative of a neurological abnormality or a congenital defect. And we're just kind of taking a look at that. With their eyes, we want to make sure that the cornea or the pupil is nice and round. They're equal and reactive. We want to make sure that the sclera is nice and white. There's no jaundice. There's no lacerations or excessive tearing or crustiness in those eyes. We want to do a red light reflex, is where we are going to shine a little light in their eyes, and we should see in each eye a red light reflex. And if we don't, that could be a more serious issue. So we would definitely like to escalate that to a hospitalization. Ears wise, just looking at the helix again, making sure it's intact. Sometimes there is misshapen helixes, making sure that the inner part of the ear is not excessively smooth, but it's got some good curvature. At this age, you are not able to look at the eardrum just because the ears are just too tiny to fit in otoscope. With their nose, we want to make sure that everything's pain. There's not excessive drooling or sniffling. The baby's not mouth breathing. Normally babies are just nose breathers. And if they are mouth breathing, then that could be indicative of an upper respiratory infection or something like that. We want to look in their mouth, and we can kind of assess their mouth by just, again, putting that little finger in. We assess their sucking reflex. We look at their lips and make sure that they are able to flail out. We're looking at their tongue to make sure that the tongue can exceed their lips, just to help with breastfeeding and helping with their latch. We can kind of put our finger or gloved finger in their mouth and inspect their hard and soft palate. On this baby, you can definitely see they don't have any cleft lips, but we do want to inspect their palate. We also want to look out for any Epstein pearls or any excessive drooling or saliva that could impact their swallowing. For their neck, we just want to look. I can unbutton our baby here. We do this exam naked, but this baby doesn't come too naked. We can look at her neck, just make sure that there's no lacerations, there's no masses or, any abnormalities seen there. Moving on to the chest, we are going to place baby on the table, and we're going to listen to we're going to assess their chest first. We're going to assess for any pectus carnatum or pectus excavatum. Looking here. Baby seems to be not in any type of respiratory distress or anything. Their color is good. So looking here, I'm going to listen with the bell of my stethoscope, just since the diaphragm can be a little bit too big. I am going to listen to all the quadrants all the cardiac landmarks that I would listen to in an adult. And I do want to listen for about 30 seconds to each area, just to prepare myself for any murmurs. Listening for that S1, S2, it is more difficult to hear these sounds on a newborn baby since their heart rate is so fast. Moving on, I'm going to have the mom hold baby so I can listen to their lung sounds. Here I'm listening for just nice, clear lung sounds. All right. You can't really tell a baby to take in deep breaths, but you can hear that his lung sounds are nice and clear. While we actually see him on his back, or on his back, listening to his lungs, we can look at the curvature of his spine. We can also assess his neurological reflex, by stroking his spine, and his spine will curve to the opposite side that you are stroking. So when you touch here, the baby's butt will kind of shift over to the other side. With the abdomen, we're kind of looking at the baby's abdomen, making sure that it is not distended. We're assessing for any, irregularities, any misshapes, any umbilical hernias. We are going to listen in all 4 quadrants. And then you hear positive bowel sounds. It's also reflective of mom saying that the baby is having 3 poops a day, and that is completely normal for a newborn baby. When it comes to looking at the diaper area, you're going to inspect each of the femoral pulses as well, holding pressure palpating them for 1 minute each, just making sure that they are palpable and they are equal. Making sure there's no diaper rash. You are looking at the labia of a female or the penis of a male baby, and just making sure there's no abnormal discharge. There's no, you want to inspect if it's circumcised or not. You also, going back to the abdomen, you want to look at the umbilical cord, and you want to make sure that it's healing properly, educating the parents to not take it off prematurely, no baths until the baby has lost its umbilical cord. And then just looking around for any rashes or any abnormalities, such as that in the diaper line. You're looking at their extremities. They should have good tone and be able to kick kind of up and down. They might fight you a little bit when you are testing for hip dysplasia. When you are testing for hip dysplasia, there's 2 ways that you can do it. So you can do the Barlow's, which is your legs are off to the side, and then you bring the legs in like this and then push down on them. So they're kind of flat. And so by doing this, if you have a positive result, then you're going to feel a clicking or a popping. There's also ortolani's, where you start with your legs in a center position with the knees bent, and you adductively externally rotate your hips, and then press them down. Kind of hard to do on this baby, but and then you shouldn't be hearing any popping. That tests for your ortolani's hip displacement. Finally, some things that we do are assessing for any type of all the reflexes that should be seen in a newborn baby. So like we mentioned before, the sucking reflex, just inserting your finger in and the baby should be sucking. Kind of just intrinsic natural reflex for them when they are hungry, especially. For rooting wise, or the rooting reflex, you can stroke the side of the baby's cheek, and that baby will turn their lips towards that area. Same thing on this side. The baby will turn towards that stroked side of their cheek. For the grasp reflex, you can put your fingers inside their little tiny palms, and the baby will hold your hand. It's very cute. With walking, so the walking reflex, hold your baby up like this, making sure to give full support. And if you put their feet on the ground, can't really see it too well, but you will be able to see the baby kind of touch down on their feet. And then when you lift them back up, they'll kind of jump their feet back up like this. Then the Moro reflex, this is a fun one, bringing the baby, kind of startling the baby, and the baby's arms will all go out, kind of hyperextend. So you kind of maybe bring the baby down a little bit faster, and the baby's arms will flail out. Babinski reflex is going to be the fanning of their toes. So when you fan their toes, you stroke down, and their toes should all fan out. And we did talk about the backstroking reflex. So this concludes our newborn assessment. just telling the parents that they will be here back again in 1 month for an exam. We do anticipate the baby to have gained about 2 pounds in the first month. Just educating them on supporting the baby's neck, since the baby does not have good strength yet. Also, just creating a schedule with your partner, making sure the 2-hour feedings, if they're breastfeeding, that's amazing. If they are formula feeding, just making sure you have a good folic acid in your formula, as well as vitamins and minerals. Educating them that there will be periods of wakefulness and activity, ensuring that the baby will be a little bit more calm when the mom picks them up. It's kind of a consoling way. And then just having the baby self-soothe as well. And then we also will be testing at this appointment for vision, for hearing, and then for biliary levels. And I think that's about it. Just making sure mom and dad feel comfortable in this new life. All right. Well, thank you so much, you guys. And I will stop recording.